So today we're going to talk briefly about something that I think a lot of people have questions about, and that is capsule tissue and capsule formation around breast implants and capsular contracture. So what is capsule tissue? Capsule tissue is the body's normal response to having something that is implanted in it, or a foreign device or object inside the body. That includes breast implants, but it also includes other types of implanted devices or foreign objects that may become embedded in the body for various reasons. And that's a normal response. It's the body's way of saying, hey, this is not part of me, and kind of walling it off and keeping it separate. So what is normal capsule tissue around a breast implant like? Well, normally it's thin and very soft and compliant. If you were to look at it inside the body when we do, like we do surgically, you'd see that it is quite thin, almost like tissue paper, maybe even wet tissue paper in terms of its fragile nature in some patients. So what is capsular contracture? Well, capsular contracture is when that normally thin and soft capsule tissue around the implant becomes really thick, hard, and sometimes very firm. What causes that? A variety of things can be associated with capsular contracture formation. Things like infection, things like ruptured silicone implants that have leaked some of the silicone, or even things like ALCL, which we've talked about on a different post. Exactly how that then turns into thickened capsule tissue is a subject for ongoing research and even some debate right now. But when that happens, it's important to recognize it and to try to identify the underlying cause so that that can be addressed. So how do you treat capsular contracture when that forms? It really depends on the severity. If it's an early capsular contracture or a mild grade of capsular contracture, it can often be treated with conservative methods. And this means medications and particularly massage to sort of loosen and soften up that capsule. If, on the other hand, the capsule tissue has progressed into a very firm, hard, and really non-pliable capsule, then it's often going to require a surgical intervention. And this involves releasing that capsule, or more often removing some or all of that thickened capsule tissue. I'm going to show you what that capsule looks like once it's been removed. So we just completed a capsulectomy. So we've removed the implant plus the scar tissue and capsule tissue around the implant. You can see here rather thick tissue that we've removed, and it's come out all in one piece. That this was surrounding the implant inside the breast. And now that we've removed the implant and the capsule tissue, we can either replace that with new implants or leave the implants out, whatever the patient's desiring. But this thick capsule tissue is the reason why some people might develop hardness around their implant, because this is very thick and tough tissue. So what happens once that thickened capsule tissue has been removed from the body? Well, certainly some patients choose to not replace their implants, and then the body just heals normally with a small degree of scar where that capsule had been. If, on the other hand, the patient wants to replace the implants, and typically a new implant is replaced into that space, and the body will hopefully form a new, thin, normal capsule around the implant. However, if someone has had an episode of capsular contracture, they are at increased risk for developing that in the future, either on that side, that breast that was affected, or on the opposite side, which hadn't been affected. So it's important to note that and to be looking for that. And whether you've had capsular contracture or not, it's important, as always, to monitor the breasts and the implants and to look for changes. If you feel like there's been a change, of course, contact your surgeon. And if you feel like the breasts have become firm or hard for any reason, it's important to notify them. If it is capsular contracture, it's always important to treat that early.